So hey guys, today we will be talking about yet another video on tuberculosis, right? So today we will gonna talk about tuberculosis, right? As I have already discussed in my previous video regarding the gone complex, gone focus, and focal point of caseating granulomas on tuberculosis. Now we will be talking about how to diagnose it, right? The blood parameters testing that are usually biomarker based genetical profile testing, so we'll be talking about that, right? So for pulmonary tuberculosis, we have different types of like testing available. The first is cbnat. Second is next generation technology genomic profiling of tb antigens, right? So that is we have like, and then we have a pcr, real time pcr for the diagnosis of tuberculosis, right? So usually it covers a wide range of varieties of genetic mutation that has been taken place inside the dna of the bacteria that leads to the generation and repression of TB antigens in a particular human body, right? Apart from that, there is other test also that is known as tuberculin skin test. That is the patchy test where a certain amount of TB antigens are like pricked out on the surface of skin, and then after 72 hours a patch testing we usually consider if the patch is showing some type of granular matter on the superficial skin surface, then we consider that there is a primary need to test for the advanced level of a diagnosis for tuberculosis, right? Apart from that, we do have NAT testing, right? CBNAT testing that I have already told you, right? So it may also clear any other genomic sequences of the bacteria, or particularly the TB is due to a primary illness of concern that has not been yet discovered, right? So that could be the differential diagnosis for like hepatitis B, C, HIV-1, and many other illness, right? Apart from that, you'll be also be knowing that the real-time PCRs gives you a way more fairer idea of the amount of antibodies that has been produced due to the TB cells, okay, TB bacterial cells, okay. Apart from that, if it is a bone related TB, then we do uh, test for lytic lesion test, okay. The lytic lesion test usually confirms whether the bone has been having any changes due to the spread of the bacteria, uh, TB bacteria in the joint areas, or inside the bone matrix, right? So that also somewhat a type of like a bone aspiration also we go for that. Apart from that, we usually take aspiration and abscess also of the particular area if it is a GI-TB or a bladder based TB, right? Apart from that, we also have a different MRI procedures, right, to detect the TB of spine, okay, or TB of brain. So in that cases also CSF collection is also possible if the mm, inflammation is on ongoing stage. So there are different varieties as I have mentioned, right? So long story short, there are n number of varieties to give about that.